HIV patient. An AIDS patient has the right to life, personal liberty, Article 21 Constitution of India. It means that he has the right to treatment of his disease like any other person. They have the right to privacy. It means that they have the same right as the other patients with regard to the disclosure of their disease status to other people and general public as a whole. In other words, one doctor or hospital cannot do things like putting labels on their bedside indicating their HIV status. Currently, the legal status of privacy in India is not strictly defined. However, the Privacy Bill 2011 has been introduced in the Parliament. Section 31 of the bill stated every individual shall, subject to any law for time being in force, in order of court, have a right to his privacy. They cannot be isolated or quarantined on the basis of their disease. They cannot be discriminated in any sphere of life, including their job, due to their HIV status. Duties of doctors. Confidentiality. Normally, a doctor must maintain professional secrecy, but in case of HIV patient, he can reveal the HIV status to the prospective bride. In case of married couple, the status of a married partner can be told to the spouse. The latter can then apply for divorce under provision of the Hindu Marriage Act 1995. Case study. Mr. X by a hospital is at the X names of all concerned parties were kept secret in view of sensitive nature of the case. Was a doctor in government service from a well-known family in Nagaland. In 1995, he asked to accompany an uncle of Minister of his state on his official duty for surgical treatment to a hospital in South India. During surgery, the uncle required blood. X donated blood on request, but his HIV blood was not used because it was found HIV positive. However, no reason was assigned in the check. 95, X proposed marriage to Y was accepted. They were officially engaged and marriage was proposed to be held on 12th 95. And marriage was called off by X sued hospital for breach of confidentiality. Judgment. Disclosure of the zero status does not violate the right to confidentiality, as the life of Mr. Y was saved. Person with HIV status have no right to marry. Reason. A duty is cast upon them not to marry. Section 216 and 270 IPC. Communicable vulnerable disease is a ground for divorce, but if it is present right at the time of marriage, it cannot be a lawful marriage. Careful screening of the blood for HIV status before blood donation, transfusion, surgical operation or organ transplantation. Precaution. Screening live donors for HIV as close to the time of the organ recovery and transplantation as possible, using sensitive testing for both chronic and acute infection, namely serological and nucleic acid testing. Inform a transplant candidate for potential risk of disease transmission. Advise donors that they have an obligation to avoid behaviors that would put them at a risk of acquiring HIV before organ donation. Arguments in favor of routine screening. Charges of negligence may be brought by the patient if patient discovered after the operation that he is HIV positive. He may allege that infection was transmitted through this procedure. Pre-operative or pre-transfusion screening will protect the doctor from such charges. Argument against screening, routine screening. The accepted ethical standard of autonomy, confidentiality, and informed consent are broken. Miscellaneous. Multiple tattooing with the same needle may cause HIV transmission. Thank you.